Many of us know the feeling. It's the one where you go to pick up your prescription from the pharmacy and you're shocked by just how much it's going to cost you. I know, it happened to me this week. And according to the White House, 1 in 4 Americans are struggling to pay for prescriptions. So the question here is, what do you do?
I had to ask an expert to get you some answers. Dr. Shadrika McIntosh owns Sozo Wellness Pharmacy in Fort Myers and says medicines for diabetes, arthritis, HIV, even chemotherapy are some of the most in demand and expensive drugs on the market.
There's oral chemo drugs too that could be thousands of dollars a month.
Money that's hard to come by for so many of us, which is often hard to talk about.
They may say, I'll be back, and they never come back.
Some people, she says, don't have insurance.
Or they may be underinsured, meaning they have insurance, but it just does not cover to the extent that they can actually afford to get the medication.
But she says there are some options to consider to help people with or without coverage get the medicine that they need. She says don't be embarrassed to just ask. Ask your pharmacy about any in-house discount programs that they may offer. Dr. McIntosh also mentioned connecting with pharmacies that work with nonprofits like Dispensary of Hope, a charitable program pharmacies like hers use. They ship medication from the manufacturer and then
Patients actually pay just like an administrative fee, the cost of our supplies, basically to dispense that medication.
She also suggests checking out the website needymeds.org.
They may have different discounts, or it may just kind of lead you to different options that are out there.
And you might qualify for a medication donation program. She says pharmacies and community agencies work together to provide medication to people who qualify and need it.
And something else Dr. McIntosh said that really got my attention is this is something we should all consider.
When there's a gap in medication access, it affects all of us because it means more ER visits. It means higher costs as far as healthcare costs. So then that also drives up insurance costs. So it's all one big circle.
And maybe paying for medication is not necessarily something that you struggle with, but you want to help out those centers that are collecting donations. I'm going to put a link on our website for you to check out, at least this one, on fox4now.com. In Fort Myers, I'm Shari Armstrong.